This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Friday, March 20th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. Now, stamping out the deadly coronavirus is proving to be extremely difficult for the world's governments. COVID-19 has infected more than 245,000 people worldwide, and the global death toll now exceeds 10,000 people. The new epicenter of COVID-19 is Europe, and specifically Italy, where health officials say the country's death toll reached 427 in just the past 24 hours, lifting the overall nationwide tally to over 3,400 since the outbreak erupted on February 21st. In Iran, health ministry officials say COVID-19 is killing one person every 10 minutes as the country's death toll soared to nearly 1,300. The United States is being slammed with coronavirus cases. More than 13,000 people in America have been diagnosed with the illness, and more than 200 have died, with the largest number of cases being in Washington State, New York, and California. Meanwhile, in Africa, the coronavirus is moving more slowly than in Europe or Asia, but 34 nations are reporting more than 600 cases, according to the Africa Center for Disease Control. African officials say that number is likely to rise in the coming days. U.S. President Donald Trump has announced that antiviral therapies used to treat malaria and Ebola are among those that could be made available as potential treatment for COVID-19. But officials are cautioning that its widespread is still a long way off. Here's White House correspondent Patsy Widakuswara.
A drug commonly used to treat malaria, a disease transmitted by mosquitoes, is being touted by President Donald Trump. On Thursday, he said chloroquine or hydroxychloroquine may be a promising potential treatment for COVID-19.
The nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody.
Last month, a French infectious disease expert made the case for using chloroquine to treat COVID-19 patients on the back of recent Chinese studies. Initial results are promising, said David Gortler, a former FDA medical officer.
And so for one reason or another, even though we don't really understand the mechanism of action, the combination of Plaquenil or hydrochloroquine in combination with the azithromycin is showing promise.
Ebola drug remdesivir was also mentioned by Trump as another potential treatment, stressing that his administration is removing barriers to roll out treatments as fast as possible. But Food and Drug Administration Commissioner Stephen Hahn was quick to point out that further testing is needed.
We want to do that in the setting of a clinical trial, a large, pragmatic clinical trial, to actually gather that information and answer the question that needs to be answered and asked and answered.
Also Thursday, Trump led a video teleconference at the Federal Emergency Management Agency headquarters with the nation's governors. All 50 U.S. states have confirmed coronavirus cases, and several are facing an unprecedented public health crisis. Patsy Widakuswara, VOA News at the White House.
Africa has the world's lowest confirmed coronavirus cases, with just hundreds compared to the global total of over 240,000. But health officials say the pandemic has special considerations on this continent, which already struggles with overburdened public health systems. VOA's Anita Powell reports from Johannesburg.
Coronavirus is creeping across the African continent, infecting hundreds of people in at least 30 countries, including Burkina Faso, Cameroon, Ethiopia, Nigeria, Senegal, and South Africa, which currently has the most cases in sub-Saharan Africa. And although overall the Africa region currently has the lowest number of cases in the world, the head of the World Health Organization did not mince words when it came to how his home continent would fare if the virus is allowed to go unchecked.
We should do all we can to cut it from the bud expecting that the worst could happen, because we have seen how the virus really speeds up and accelerates in other continents or countries. So that's our advice. And I think Africa should wake up. My continent should wake up.
Health officials say they're especially concerned about the health issues that are all too prevalent in some parts of the continent.
But we have not seen the way this virus will behave in other vulnerable populations. We have not seen how this virus will behave if and when we see in vulnerable populations of high prevalence of HIV, for example, or malnutrition children, for example. And that's what we need to prepare for.
South Africa has 150 confirmed coronavirus cases so far. The rising number has prompted President Cyril Ramaphosa to announce tough measures to try to slow the virus's spread, like a travel ban from high-risk countries, school closures, and a ban of gatherings of more than 100 people. South Africa also happens to have the world's highest burden of HIV.
Now, and I think there is not really any specific information yet available on how this disease affects HIV-infected individuals. But if we think about what we know from other respiratory viruses, such as influenza, and how they present in HIV-infected people, we do know that HIV-infected people, particularly those not on treatment, are at risk of more severe illness.
One grim reality experts say Africa must brace itself for. This is going to be a tough ride. Anita Powell, VOA News, Johannesburg.
International aid groups are warning that any outbreak of COVID-19 in refugee communities could have a devastating impact. The United Nations estimates there are more than 30 million refugees worldwide, many living in conditions that are ideal for the transmission of the coronavirus. Henry Ridgewell reports.
Across the world, health authorities are telling people to stay home, to keep away from other people, to make hygiene a priority. What chance of that in a refugee camp?
Many of these refugees are often packed very tightly into camps, and that makes a big difference to transmission. The access, of course, to water, sanitation and hygiene makes a big difference, and also just their general nutritional state. They're in a huge state of stress anyway, which suppresses their immune systems.
Cox's Bazar in Bangladesh is home to 900,000 refugees who have fled violence in Myanmar. Knowledge of the COVID-19 virus is varied.
I forgot the name of the virus. I heard that disease has occurred in different countries. People are dying, so we should clean our hands.
That good advice is mixed with rumor and misinformation.
I heard that if you are attacked by the new disease, the hands and feet are disabled. Saliva falls from the mouth. The injured person barks like a dog.
Camp authorities are trying to screen all visitors and new arrivals.
We have instructed the foreign aid workers to scan their health condition themselves and not to bring any new workers from abroad.
Kanke camp in northern Iraq is home to 15,000 Yazidi refugees. The Ammar Foundation has led COVID-19 awareness programs and advice on preventing transmission.
Of course, many refugees, and particularly internally displaced populations, live in makeshift camps very far away from any sort of external official help. And those are the ones that are really very, very vulnerable.
That includes the hundreds of thousands escaping conflict in Syria's Idlib province, where aid workers are receiving instructions on coping with any outbreak. Thousands of migrants are stuck in makeshift camps on the Turkish-Greek border. Many more live in overcrowded camps on the Greek islands, and aid groups say Europe must evacuate them urgently as the coronavirus threat looms. Kakuma in Kenya is home to almost 200,000 refugees. One told VOA that nothing has been done so far in terms of raising awareness in the camp of the coronavirus. Many camps are in countries with stretched or under-resourced health systems: Kenya, Bangladesh, Iraq, Lebanon.
They were already operating at a very high capacity, and so the question is, will they be able to redeploy to accommodate people who live in camps?
Even rich nations are struggling to cope with COVID-19. Any outbreak among refugee communities could have catastrophic consequences. Henry Ridgewell, News, London.
Britain is facing a major problem with a shortage of ventilators needed to treat critically ill patients suffering from COVID-19 after it failed to invest enough in intensive care equipment, according to a leading ventilator manufacturer. Emma McCarthy reports.
A leading Swiss ventilator manufacturer has warned that Britain faces a massive shortage of ventilators that will be needed to treat critically ill patients suffering from the coronavirus after it failed to invest enough in intensive care equipment. Life-saving pieces of equipment, ventilators are used to help people with respiratory difficulties to breathe. Andreas Wieland is the chief executive of Hamilton Medical in Switzerland, which it says is the world's largest ventilator maker. Hamilton has boosted normal production by 30 to 40% and now can produce about 80 ventilators a day. He says that England faces a major problem.
They invested very little, and I think now they pay the price.
Worldwide, the devices have become shorthand for the rapid advance of the disease and the desperation of officials who fear their costs are inadequate. New York Governor Andrew Cuomo recently said that 3,000 devices in his state, where 20 people have died, are a fraction of what he'd like to have. In the UK, Health Minister Matt Hancock has acknowledged that the existing stock of 5,000 ventilators is inadequate.
That was Emma McCarthy of Reuters reporting. Emergency services and fast responders are preparing more and more to deal with the coronavirus emergency. Fire departments and medical personnel now are receiving more equipment to better serve the community. VOA's Christina Casedo-Smith visited a fire station in one of the biggest counties close to Washington.
Fire and first aid services in the United States anticipate an increase in cases of coronavirus emergencies in the coming weeks. In Montgomery County in Maryland, first aid services are adding more emergency kits for its patients and to protect its first responders and medical personnel.
Additional protective equipment, masks, gowns, eye protection to our personnel to be prepared to treat patients who are potentially COVID-19 or anybody who's got influenza-like symptoms where they're coughing, they're sneezing, they're having a fever.
As part of their emergency preparedness, officers and medical personnel meet daily for the latest information.
Career personnel, we have roughly 700 to 800 volunteer firefighter EMTs as well. We have well over 1 million citizens in Montgomery County.
For Captain Oscar Garcia, being prepared for a coronavirus emergency is essential.
For the most part, we have 10 of everything. 10 masks, 10 protective sheets. We have 10 respirators for firefighters as well as patients, and we have them in every unit. We have 35 stations in the county, and each unit that is going to respond to emergencies in the county is going to have those kits to prevent and isolate people who may have the virus.
But Captain Garcia says some residents are afraid to call 911 due to their immigration status.
If you need any fire department services, whether it's medical or fire, please call 911. Understand that if you call or when we get to your home, we are not going to ask anything about your papers or immigration status.
Due to the coronavirus emergency, 911 emergency crews had added 3 questions when people call 911. Do you have a cough? Do you have a fever? And do you have any respiratory illness? As part of the preparation and strategy for the coronavirus, health authorities are also preparing pop-up hospitals and camps for potential emergencies. Christina Caicedo-Smith, VOA News, Rockville, Maryland.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Still to come, in these times of gloom, Malian artist Baseku Kuyate brings you a message of peace and tolerance. We'll be back. With the coronavirus pandemic alarming the global community, South Sudan is grappling with another potentially fatal viral infection, measles. Last year, more than 4,700 people were affected due to low immunization coverage. Chika Odua reports from Juba.
Shejirina Moni lives in Juba. 6 of her 9 children have died of various illnesses.
The first one died at 9 months. Another one died at the age of 10 months. Another one died when he was crawling, about 3 months.
Millions of children in South Sudan do not get routine vaccinations. Now, the country is battling an unprecedented measles outbreak with over 4,700 confirmed cases and 26 deaths since January 2019. In February, a nationwide measles vaccination campaign was launched here, the only children's hospital in the entire country. The campaign aims to reach 2.5 million children by April. One reason why childhood immunization coverage is so low is because of the challenges in keeping vaccines at near freezing temperatures.
We are able to keep these things at required temperature in the hospital here. That is the most important thing.
UNICEF provided the solar-powered fridge. The organization is helping to restore what is known in healthcare terms as the cold chain system, which was severely disrupted during the civil war that broke out in 2013. Even private partners like Continental Medical Supplies are getting involved to make sure life-saving medicines stay fresh at every step in the cold chain.
If you break the chain, the product will be 100% destroyed.
Another reason why immunization coverage is low is because people aren't informed.
Sometimes I knock the doors. So if they did not come and know that this house have kids, they did not come and go and knock the door. We are doing vaccine, why are you not coming? So I'm busy, I'm not saying, can I have your kids? And I'll return it back. They say it's okay.
The efforts are paying off. So far, the vaccination campaign has reached more than 1 million children, including Shejirina's. Chika Odua for VOA News, Juba, South Sudan.
Officials in Nigeria's Kebbi State have revived the Argungu Fishing Festival, which was halted in 2009 because of the threats from Boko Haram terrorists. Authorities say with security progress against the Islamist group, the festival can resume and provide jobs and income to thousands of people. Timothy Obiezu reports from Kebbi.
Thousands of spectators attended for launch of the 2020 Argungu Festival in Nigeria's Kebbi State. The popular fishing and cultural festival reopened this month, more than a decade after it was suspended because of the Boko Haram security threat. Festival officials say it signals the progress made against the terrorist group.
It is about 10 or 11 years now without the festival. I've been very happy planning of this comeback edition this year because it's a good time to remind us what this festival stands for.
The Argungu Festival ranks as the most widely attended in Nigeria, and it's one of the oldest too. It started in 1934 to mark the end to centuries of hostilities between the Kebbi people and their neighbors in the region, and also to promote fishing, which is how most people here make their livelihood. Decades later, the event attracts thousands of Nigerians and people from neighboring countries like Cameroon, Niger, and Benin.
We thank the government for bringing this back and stabilizing security here. We'll put our hands together to help the government. This thing is here to stay.
The festival includes games, including one with a cash prize of $27,000 for the participants who catches the biggest fish. The winner this year pulled in a fish weighing 78 kilograms. Some Kebbi residents are attending the festival for the first time.
Yeah, I've read about it.
that it has been happening before, but I've been in Kebbi for 5 years now. I've not witnessed it. So I felt it's an opportunity for me to come and witness it face to face, and it's quite interesting.
With no security threats, participants are hoping the festival will be back again. Yobuzu for VOA News, Kebbi State, Nigeria.
Here in the U.S., as Vermont Senator Bernie Sanders' prospects fade for winning the Democratic Party presidential nomination, questions arise as to whether he or his ardent supporters will back the more moderate winner, former Vice President Joe Biden, or not in the presidential election.
After a string of decisive primary losses, Vermont Senator Bernie Sanders is reportedly considering ending his presidential campaign, ceding the race to former Vice President Joe Biden for the Democratic nomination. But many of his young, passionate supporters are not ready to give up.
I don't think I am obliged to vote for the moderate just because, I think that's pretty ridiculous. There's a large chunk of the Democratic electorate that feels pretty passionately about Bernie.
Sanders, a self-described democratic socialist, has gained a fervent following with a sweeping progressive agenda for free health care and free college education nationwide. To his supporters, the coronavirus crisis that has become the focus of American life underscores the need for these policies. However, voters this year have coalesced around the more moderate Biden, who helped enact limited health care reform as former President Barack Obama's vice president.
To me and to many other people who study presidential rhetoric, would suggest that voters would want to go with the person who portrays the most stability, the most knowledge of the way government works, the most sort of stability in a gentle, less than authoritarian sense.
Many Democrats want to prevent a repeat of the 2016 race, in which Sanders' protracted primary challenge to Hillary Clinton divided the party and many analysts believe contributed to Clinton's loss to Republican President Donald Trump. The former vice president has reached out to Sanders supporters.
So let me say, especially to the young voters who have been inspired by Senator Sanders, I hear you. I know what's at stake. You know what you have to do.
But many Sanders followers are deeply disappointed by Biden's surge in the primaries, distrustful of Biden's political moderation, and question the validity of recent primaries in which many voters stayed home to avoid the risk of coronavirus infection.
I don't know how legitimate these results are. I don't know if we can use them as a barometer for how people actually feel right now.
Feel the burn! Even if Sanders concedes the race, many of his followers may not. Brian Patton, VOA News, Washington.
Sekou Kouyaté is an internationally acclaimed Ngoni musician from Mali. He and his family band are griots. They come from a long line of hereditary musicians who are the nation's traditional oral historians. They were on a tour of Europe when COVID-19 hit. Heather Maxwell spoke to the maestro by phone earlier this week and learned that the family's extensive European trip was cut short due to the coronavirus outbreak. 10 concerts were cancelled, and the family was stranded in Frankfurt for days, struggling to find flights back to Bamako. Sekou had to purchase not one, but 2 sets of airline tickets for his band after the original return flight was cancelled until finally finding seats on Ethiopian Airlines. The artist told Maxwell that his family took a personal loss of about 60,000 euros. Despite the financial loss, Sekou says he is happy to be back in Bamako. Here is Jamako. His wife Amy sings to encourage tolerance and peace, reminding all of Mali's historically open spirit despite troubled Today, be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, have a great weekend.